Hi guys, welcome back to another episode of Nursing with Ingrid. Thank you very much for all the subscribers. Thank you very much for liking my videos, and thank you very much for all the support so far. Today I'm going to be discussing one of the most important things that we hardly ever speak about within the nursing fraternity, and that is self-care. Right into it. Let's talk about nutrition. When it comes to nutrition, we have to make sure that we have a balanced diet every single day, and preferably let us get into the habit of having a breakfast, because that helps sustain your blood sugar levels for a much longer time, and it also helps with boosting out your metabolism. The next thing I'd like us to consider is the type of snacks or the type of lunch that we pack. If you have some nuts and you have some fruit, it's easy to grab a handful of nuts or grab a piece of fruit and carry on with your duties without you going into an absolute slump, an energy slump. So those are the things that I would recommend with regards to nutrition. Another thing that I'd like us to look at is also hydration. Hydration is very, very important. I cannot stress it enough. And why do I say that? Because at the end of the day, we want to stay hydrated, and as nurses or healthcare workers, you find that you'll go the whole day without having a sip of anything to drink, right? So please make sure that you do have water or a juice that you can quickly sip and carry on with your duties or with the rest of the day. But having hydration is very important. Number one, it flushes out the toxins in our bodies, it rehydrates our bodies, and it also gives us a glowing skin. It's good for your skin as well. I would try to stay away from your teas and your coffees because of the caffeine in them, and the fact that you get that high immediately and then you slump again. So water and juice is the safer options when you've got a busy day ahead, just to grab some water every now and again and carry on with what you need to do. Next up, let's discuss body mechanics. Now, body mechanics is everything to do with your body and maintaining your posture and not injuring yourself unnecessarily. The one thing that we don't realize as nurses or as females is that sometimes our underwear is the main factor to our discomfort and to our backache, okay? And when I say that, it's because that has happened to me. So please, ladies, please make sure that you go and you get yourself fitted with a well-fitting brassiere. And what this will do for you is it will straighten up your posture automatically, and it will alleviate the pain in your shoulders and in your neck. We generally suffer with neck and shoulder pain because of ill-fitting brassieres. So ladies, please go out to your departmental stores and get yourself fitted, and there's a beautiful affordable range that you can get from I believe it's Ackerman's. They do have a very affordable range if that is the way you want to go. But please, I cannot stress this anymore. Please get yourself fitted with a proper fitting bra. The next thing to consider is our footwear. I know that it's easier, or it seems logical, to wear flat foot shoes, but invariably they do more harm than good. So you will find that at the end of the day, your feet are super tired, super painful. I would advise you guys to look into something like your Green Cross and your Froggies, because they have nice, decent heels that are very supportive as well. And it also helps with your ankles and the swelling and pain, unnecessary pain. And another thing, when it comes to your footwear, please get a type of footwear that you can aerate, so that it stays fresh, so that you have longevity, and so that you can have value for money out of it. Also with body mechanics, another thing that we need to take cognizance of is the fact that because we stand such long hours, we end up with varicose veins and DVT. And how do we prevent that? You can get yourself compression stockings. And I would really emphasize that you do get yourself a pair of compression stockings, or pantyhose for that matter. Now you have different types of compression stockings and pantyhose. You have your knee highs, you have your thigh highs, and then you have your full stocking. I would much prefer that you guys wear a full stocking because number one, it's normally a graduated compression stocking, and they are very affordable in the long run. Okay, the one range that I really like is this one. And this is, it comes in different colors. You can get these at Dischem, and they are very affordable with regards to getting that support that you need in your lower extremities, and also helping with the circulation and bringing that blood flow back up to the upper part of your body. These are very good stockings, I must say, and they come in different colors. So you can wear them with your pants, or you can wear them with your skirts if you wear dresses to work. Okay, the other range, which is slightly a bit more expensive, is this range. But however, this has got a complete, I'm going to show this to you, it's complete protection throughout your legs, okay, from your toe all the way up to your waist. And this is good because it also helps with the stocking. The band of the stocking helps pull your core in and supports your core. With that being said, automatically when your core is supported, it alleviates your backache. So please consider any one of these two stockings or pantyhose as opposed to your knee highs and your thigh highs. Now let's go into rest and sleep. When it comes to rest, that is one of the most important things that we can do for ourselves, and I would like you guys to consider sleeping in the recovery position because it helps alleviate your backache. It also helps with blood flow all over again, and it also helps you with your breathing, as opposed to sleeping on your back, which might cause you to snore, number one, and it will give you sleep apnea. So when you sleep on your side, it's a much more comfortable sleep. You're getting the proper oxygenation. Your lungs are breathing in full capacity. They're expanding to full capacity. And with the one thing that you need to remember or to be aware of is that when you're in the recovery position, you've got a pillow between your knees and a pillow under your heel. So that helps with your circulation backflow, and it also gives you a very good restful sleep. Also, guys, during your lunch times, it is important for you to elevate your feet as much as you possibly can, and also depends on the unit that you work in. If you are able to elevate your feet, then please take that opportunity. Every time that you get to sit down, please elevate your feet because that will help a whole lot. Okay, now I'd like us to talk about something that is way off topic, and that is our skincare. Skincare is very important as well because we are under artificial lighting all day for up to 12 hours a day. Your skin tends to get dry, so it is very advisable for you guys to look into a skincare range that is suitable for your skin type. And also bear in mind that you can use a sunscreen, which I always do, because of the artificial lighting that has UV rays in it sometimes. Finally, I'd like us to think about downtime and mental health, and just trying to keep yourself together as much as possible. At the end of the day, you should come up with a routine that helps you to de-stress. Find something that you can do, that you enjoy doing actually, that will help you de-stress so that you can be relevant to your family the same way you were relevant to your patients the whole day. Maybe it's taking a bath before you do anything else. It's listening to music on your way home. It's reading a book on your way home if you use public transport. Find that one thing that you can do that will more or less tell you that it's now time to transition from work to home, and that will give you a well-balanced life as much as possible. I hope you enjoyed this video. We covered nutrition, we covered body mechanics, we covered rest, we covered skincare, and we covered downtime. guys, if you like this video, please give it a thumbs up. And remember, you can find me on LinkedIn, Facebook, and Instagram. Please don't forget to put a message down below. Please like this video, and please don't forget to look out for my next video, and that is for all my students, nurses that are coming into the nursing fraternity. I've got a little bit of advice for you guys. Take care, stay safe, and God bless. Bye-bye.